who probably doesn't need any introduction on the continent, Professor PLO Lumumba. He's a consultant with Lumumba and Lumumba Advocates, a member of the African Justice Group. He's an advocate of the High Kenya and Tanganyika and a certified mediator. He has authored several books and is recognized as one of the leading public speakers of the continent and the African diaspora. He's founder of several organizations, including PLO Lumumba Foundation, a charitable organization in operation since 1990. He has been twice recognized as one of the 100 most influential Africans, and we are very happy to have him with us this afternoon to help us understand why governments in Africa are turning a blind eye on epilepsy. Good afternoon, Professor.
Yeah, good afternoon. Let me start by congratulating the International Bureau of Epilepsy and the African Bureau of Epilepsy for organizing a webinar around a medical condition which is not very well understood. I note that my very good friend, Dr. Simeon Karaoke, had already started intervening in a very technical area, which indeed is his area. But the question that you want me to deal with is non-technical, but yet very important. Indeed, it is coincidental that exactly 20 years today, on the 27th day of April, the year 2001, African leaders met in Abuja in the Federal Republic of Nigeria and declared that the countries would spend 15% of their annual budgets on health. The story, as you and me know, is that no country has succeeded in doing that. Of course, there are few countries that have moved in that direction, like Rwanda, Botswana, Namibia, but even those countries that have done well have not achieved that. The significance of that is that African budgets have not been deployed in a manner that is capable of dealing with all health issues. And if there was any doubt about it, the manner in which we have responded to the COVID pandemic is generally indicative of how weak our health systems are. When we talk about ICU facilities, when we talk about the availability of vaccines, we talk about the availability of nurses, of doctors, and even if they are there, the facilities that are available to them is not anything to write home about. So while we may say that the governments have turned a blind eye to epilepsy, the real issue is that many governments have turned blind eye to the entire health situation. And in many cases, when we respond to health issues, it is almost on a crisis basis. But Africa finds herself in a very unique position as regards epilepsy, which, as Dr. Karaoke alluded to, is a disease that is very thoroughly misunderstood in many nations and communities in Africa. Many of you who are listening and participating in this webinar will know that epilepsy is attributed to witchcraft. Epilepsy is attributed to curses. It is attributed to many other things which cannot be explained scientifically. And I dare say that even the individuals who have the honor and privilege of serving in African government don't understand epilepsy and therefore don't give it the pride of place when we are talking about the diseases that afflict Africa. But yet, it is one of the most debilitating conditions. It is one of the conditions that affect people, and it affects them in secrecy, because people who are afflicted by this condition are oftentimes stigmatized, and the stigmatization leads to ostracism, and that in itself does in fact affect the manner in which the medical world also treats epilepsy. But that is not to say that African governments have not paid attention to the problem of epilepsy. Those of you who are familiar with the issue of epilepsy will remember the African Declaration on Epilepsy in the month of June and the month of May in the year 2000 in Dakar in Senegal. African governments sat in Dakar in Senegal in the year 2000. In fact, that was a year before the Abuja Declaration on Health. And the Dakar meeting did identify the fact that epilepsy was a disease that ought to receive the necessary attention because of its impact. Indeed, the statistics which will be shared by experts will demonstrate that aside from Latin America, I think that Africa is the one that labors under epilepsy more than any other continent. But I leave the scientifics and the statistics to those who are better educated in that area than I. Mine is to raise and flag out the issues which are of a general nature, and that is where the Dakar Declaration comes in. And to demonstrate that African governments who are actually concerned about it, at least as animated by the scientists in the area, a year later in Harare, there was a consultative meeting, which was a follow-up to the Dakar Declaration, which was designed to understand how the Dakar Declaration had been implemented. But as you appreciate, many African countries have had different economic problems, wars and other things, and therefore the budgetary allocation to a condition which is not given the prominence of Ebola, the prominence of malaria, the prominence of water diseases, is that it is neglected in many ways. And you will be told by the experts who are present in this assembly that even in the medical world, even those who are trained as scientists, in their unguarded moments, they relapse into the belief that epilepsy is witchcraft or a curse. So we come from heavy burdens in our society. And it is necessary that our African governments ought to be educated. And an interaction such as the one that you are having today ought to be one of the avenues via which African governments are educated. And I'm glad that the president of the International Bureau is here. I'm glad that those who are present at the leadership level in Africa are here. I'm glad that the researchers are here. And it should not end here. Because one of the problems that we have in Africa is that we have these jamborees, either virtual or physical, and we produce a lot of good ideas. And these ideas are then shelved so that policymakers and decision makers are not involved. I would have loved, for example, that in a webinar such as this, all African ministers for health come in and participate from the beginning to the end. Because one of the problems with African politicians that they come at the opening session, once they have read speeches that are written to them, then they disappear. And they have no idea completely what has been discussed at those sessions. It is important, therefore, that as we go forward, we recognize that indeed African governments have recognized that epilepsy is something that ought to be dealt with very seriously. And perhaps now that we have the Center for Disease Control, the 5 of them, with the headquarters in Addis Ababa, Ethiopia, I think one is in Gabon, one is in Zambia, one is in Kenya, and one is in Egypt. The 5 Centers for Disease Control and Research Organization, the Malagasy Institute of Applied Science, the Louis Pasteur Center in Dhaka, Kemri, and the different organizations should now focus on epilepsy as one of the major diseases that require attention. I know now that COVID has captured the attention and imagination of all of us, but we ought to remind ourselves, as I've seen people being reminded, that COVID is here with us. but epilepsy is also here with us. HIV/AIDS is here with us. Malaria is here with us. Ebola is here with us. And lest we forget these conditions which are present with us as we pursue COVID, it is important that we remind ourselves, and I cannot emphasize enough that this webinar has come at an opportune time when African countries and African governments are now ruining the days when they did not set aside sufficient funds for the health sectors. And I believe that if we trace our steps a little backwards and we go to Abuja in the year 2001, we will recognize that we ought to have set aside 15% of our national budgets for purposes of ensuring that we have health and health sector as a place that deserves attention. Once again, I believe that if we go back to the African Declaration on the question of epilepsy as was articulated in Dhaka and the consultative meeting in Harare in Zimbabwe, we will be able to recognize that indeed there is need for something. At forums such as this, beyond criticism and beyond critiquing our governments, we also ought to appreciate that governments are now suffering in a real way. There is not a single African economy that I know now which has not shrunk in real times. And I think that it is not only governments that we should talk about. We should talk about private sector. In other parts of the world, the private sector is very active in supporting government in a deliberate and creative way, particularly in the area of research. If we could, and this is where once again governments come in, if government could create tax incentives so that the private sector could collaborate with research institutes and deploy money for purposes of ensuring that research is undertaken. When my good friend Dr. Karaoke was speaking and I saw the distribution of the resources, you can see that the availability of resources and equipment is very much a product of economic ability. It is Morocco, it is Egypt, it is South Africa, which means that you have outside of in sub-Saharan Africa, the only two countries that we are talking about at different levels is South Africa, to a very less degree, Kenya and Uganda. If you go to the entire Sahelian area, the entire Sahel, not even a single country. And when you go to the Maghreb, it is only Morocco and Egypt. That tells you that until and unless the private sector also weighs in, we are going to have these declarations, we are going to have Abuja, we are going to have Dhaka, we are going to have Harare, we are going to have Eswatini if they come and others. But the truth is that our words will not be matched with the necessary funds. And as I conclude, Africa has no shortage of men and women who are properly trained. There are men and women who are properly trained both in the continent and outside. If you look at the researchers and doctors who are resident in Europe and America who are of African origin, they are there. The only reason why they cannot come to Africa is that when you come to Africa, you find yourself handicapped because you have no resources, you have no equipment, and the environment itself is not incentivized. So I hold the view, as you continue with this webinar, that you will benefit from the contribution of experts, and that those experts will and the organizers of this particular webinar will compile the proceedings of this engagement in a manner that is useful so that we go out there and engage government in a positive way. I believe that if we do that, then all of us, our hands will be on board and we will be able to help ourselves and help our government. And let me say, whenever we talk about governments, we must never see governments as being apart from us. We are part of the government. We only, when we talk about government, we are talking about the administrations at that time. And being members of the government, we also have a duty to play to ensure that we create awareness in our own spaces. And if we do that, then I have no doubt that our governments will wake up and that some useful resources will be dedicated to epilepsy, which, as I've already said, is a disease which suffers from stigmatization and which is not well understood even by those of us who have had the advantage of formal schooling. God bless you.
Thank you very much, Professor Lumumba. Again, this session is being recorded, and so we can come back to it and listen over and over. We have a few questions for you before you take your leave. Action Amos, please, for those with questions, we encourage you to keep it simple and short, straight to the point. Action Amos.
I think there was one question that came through a text message to Prof. It's about how he sees interworking with other partners within the region, especially African Union, Pan-African Parliament, and other institutions of goodwill. So maybe a comment about our institutions within Africa.
You know, Amos, one of the things that I've discovered as I look at Africa, there is no shortage of institutions. Number one, there is no shortage of declarations. There is no shortage of good research work. There is no shortage of men and women who have been properly trained or who are waiting to be trained. There is sometimes in a number of countries, even the laws are there. Even the policies are sometimes there. I think our weakness is implementation. And implementation comes about because we don't have the financial resources. And my view, therefore, is that collaboration is very important. And if you look at the research institutes that are now around and about Africa, if only they collaborated so that what is happening in Dakar is known in Madagascar, is known in Eswatini, is known in South Africa, and is known in Tunisia and in Niger and in Mali, then you would be amazed. The universities in Africa don't even have meaningful exchange programs. If you ask many of the doctors who are present here, they have had exchange programs with Oxford, with Johns Hopkins. But if you ask a doctor at the Anti-Check Diop Hospital in Senegal whether they know of a program in Nairobi, Kenya, or Dar es Salaam or Makerere, they don't know. And we now know that the research funds that are given to us from Europe and America, only a small percentage of it actually remains in the continent. And my own view, easier said than done, some may say, but if we focus on research and development and under the aegis of the Centers for Disease Control, luckily now we have things working in our favor. One, you have a very strong person who is at the WTO in Okonjo-Iweala. How can he work with that? You have Bianyima at UNAIDS. You have the Tewodros, who is at the World Health Organization. You have the Centers for Disease Control, the 5 of them. If all those efforts are coordinated, Amos, I can tell you within 2 years, you will begin to see movement of an amazing nature. So one of the things, as I conclude in answering that question, is I wish that Africa should now halt and said, we have made enough declarations. We have made enough laws. Can we take the following 5 years to implement what we have declared, what we have undertaken, and deploy funds in that direction? And my good friends who are here will tell you that there are Africans outside in the diaspora who would want to share the expertise that they have acquired over the years with people in the mother continent, but the circumstances must be created which will enable them to do that. If we can't all have labs, let us SADC have a good lab, one good lab in South Africa. Let East African community have one good lab in Dar es Salaam, let Morocco, and let me tell, and the Horn, we have one good lab in Addis Ababa, and you'll be amazed at our ability. It is not because of inability, it is lack of coordination and lack of deployment of resources.
Professor Lumumba, we understand that you're rushing to beat the curfew, so we'll take just one more question for you. In the first presentations with Dr. Simon, he gave us statistics about situations of countries where you may have one psychiatrist to 100 patients, and this gross lack of specialized skill. And I hear you clearly when you say that we have this specialized skill, but it's out of the continent. What, in your opinion, would be a good way to mobilize African specialists in the diaspora to serve on the continent? How can we
at the end of the day, I think experts, and there are experts in the medical field present in this webinar, an expert will tell you, in order to fulfill myself at the highest level of expertise and professionalism, I need facilities. So provide them with facilities. Number two, I need resources. If I want reagents, if I want equipment, I want the equipment to be available so that I can deploy my intellectual resources effectively. And once I have the resources and I have the working environment, I want to be in a position and to be enabled to consult with expertise and experts outside or within the continent. I think we don't do that often enough and well enough. And slightly off epilepsy, see the number of nurses that we train in Africa, and half of them then run away to the United Kingdom. We give them the finished product. Look at the number of Nigerian doctors who are practicing outside of Nigeria, or Ghanaian, or Cameroonian. I know Dr. Folefak, who is my friend, who is one of the leading doctors at the University of Ohio in Columbus. He could be, if there were circumstances which were favorable in Yaoundé or in Douala, he would be there. But he prefers, because of a number of reasons, to remain there. And I'm sure you can count a number of Cameroonian doctors who are scattered in France and other places, and our friends in Eswatini. So I think what we should do is to create an environment that attracts our professionals. Some of them are prepared to sacrifice. I've met doctors. I met a lady, doctor in Austria, who is from Zimbabwe. When I said people should come back, she told me, I can hear you. But when I left Zimbabwe, my salary was the equivalent of $5. Should I have remained? I said, no, you should have gone. Because she told me I have children's school fees to pay. But she told me, if they can pay me $1,000 instead of the $5,000 that I'm earning here, I would go back home. And there is no shortage of such people outside of the continent. And that is where I think you are in this space. Beyond what you are doing as technicians, do know that is not for the faint-hearted. You'll knock 10 doors before one opens. And once you know that, you will do it again and again. And I think that even within African bureaucracies, there are people who are now beginning to realize, perhaps that is one of the things that COVID has brought about, that for the first time, Africans, particularly the political class, cannot go to Europe and America to seek medical attention. They are now being told that when you are sick, you've got to be in Africa. And for that reason, I suspect that in the next 5 years, you are going to see a lot of investment in the health sector. And that is a good thing. If there was a silver lining or in this cloud that is called COVID pandemic, that is it, the increased financing in the health sector. Thank you very much.
Thank you very much. Thanks for your time, and thanks for sharing this time and the knowledge with us. We understand you have to take your leave. That is great. We will continue with the other questions for Action, Amos, and Dr. Simon. Thanks again, Professor Lumumba.
Thank you. Thank you very much.
You're welcome. So Amos, there is a question that